Well, at least I'm going to see Dr. Pivot now. I think she'll say I'm going fine, because I see her quite a lot around the wards, and she's watched me a few times in emergency. I'm efficient, I get through my list quickly, and I've been able to get away from work on time. Yeah, I think she'll say everything's going okay.
Dr. Grades has asked me to see Marco and he's coming in 10 minutes. What'll I say to him? He's got some good skills, particularly when it comes to procedures. He's certainly experienced and doesn't have any trouble in the busy clinic, but I don't know, he's just not a team player. He's not good at hearing what other people are saying to him. He's actually a bit too sure of himself. I notice he tends to rush and jump into things without really giving any thought to alternative approaches and treatments. I really need to let him know that he should be more focused on patients and their needs, and to really listen to what the patients are telling him. He really needs to take time to sort out underlying issues rather than just thinking he's got all the answers straight off. I need to get him to accept that teamwork is important and a really necessary feature of good clinical practice. This could be difficult. I just need to go over in my mind how I'm going to approach it. Oh, Marco, come in. How are you?
Not too bad, thanks. How are you?
Good. Have a seat. Now, Dr. Grades has asked me to go through your assessment with you. How do you think you've been going this term?
Well, I think I've been going all right, but I think Dr. Grades thinks differently.
Yes, look, we've spoken about that and we both agree that it's probably best for me to give you some feedback about your performance, because we have actually been working together quite closely for the last couple of weeks. So perhaps the best thing is for us to go through your report. Yep.
I mean, as you can see, I'm really happy with the high marks in my procedural skills and things like that. And I explained to Dr. Grades I've had lots of experience in busy hospitals and I think I'm going quite well. It's just these marks here, the really low marks in communication and teamwork. I don't understand. I think I'm doing quite well and these marks are really low. I just don't understand. Okay,
well look, this is probably a really good time for me to give you some feedback about what I've observed when we've been on the ward together. And it seems to me that you're very much inclined to give the impression of hurrying, especially with patients, that you're rushing them, that you're not really listening to what they're trying to tell you, and that you're not seeming to be interested in their story or how they're feeling about their problems and their illness. Now, I'm sure that you're not setting out with that intention, but nevertheless, that's the way you're coming across. And the problem with that is that you're missing out on the opportunity to get some really valuable information from patients. But as well as that, by failing to kind of establish a good relationship with them, they're going to be much less inclined to tell you the real details, particularly the intimate details of their problems. They'll also be less inclined to be compliant with the treatment that you suggest to them. So I think that that's something that you're really going to have to think about and work on a little. How do you feel about that?
Well, I feel I've got just such a heavy workload that if I don't rush through patients and get through them quickly, I'm just worried I won't get through it all.
Yeah, look, I completely understand that, and it's a balancing act that everybody in medical practice has to manage. We're always busy, but it might be helpful for you to think about it from the patient's point of view and to actually put yourself in their shoes. Perhaps an example, just yesterday when we were doing our ward round, do you remember when we went to see Mrs. Winton, the lady with heart failure? Yeah. While we were standing around the bed talking to her and about her treatment and what we were going to do next, I noticed that you spent the entire time with your nose buried in her medical records. Now, clearly that's an important part of your duties to maintain the medical records, but there were a couple of occasions when Mrs. Winton actually looked directly at you and was obviously seeking some sort of response from you or feedback from you, and you missed that completely. You were really just not engaged with her. Do you recall that episode?
I do, and I think it's a pretty good example that she may have felt I was rushing and really not paying attention to the details she was giving.
Yeah. And following on from that, I think that there's also an issue about listening and valuing other members of the team, the healthcare team as well. As a medical practitioner, you really need to take every opportunity to get information from as many sources as possible, clearly from the patient themselves, but also from other members of the team, and especially the nursing staff, because in this sort of situation, they're with the patients all day, every day, and see and hear things that you miss out on, and it's really important that you take the opportunity to listen to what they've got to say to you. I noticed a little episode just a couple of days ago where we were on the ward talking about a patient, and there was a nurse actually waiting to talk to you, and it was really obvious that she was waiting to talk to you. But when we'd finished talking together, you turned away from her and walked away and missed that opportunity to speak with her. Do you remember that?
Oh, look, I'm not entirely sure. I think I would have just been really busy after rounds, and I don't think I noticed.
Well, look, can I suggest to you in situations like that an alternative approach might be to at least acknowledge that you know that she's waiting to talk to you, and to say, look, I'm really busy right now, but I'll come back and we can talk about whatever the problem is in a little while. Of course, then you've got to go back and do it. But then she feels valued, she feels part of the team. You don't miss the opportunity to hear whatever it is that she's got to say to you, and it just creates a much better team relationship, which after all is for the benefit of the patients in the long run. So perhaps I could ask you to summarise the things that we've talked about and to tell me what you're going to do to make sure that these things are addressed before your next report.
Okay. Well, I think first and foremost you've shown that I'll focus on my patients and work on trying to give them a little bit more time, make them feel that they are valued and that their feelings of their condition are just as important as the actual illness itself.
Yeah, that is really important. But what about the team work aspect as well?
Again, you've brought forward an example that I'll try and work on giving time to all members of the team, especially the nursing staff, to feel that they're acknowledged and they're a valued part of the team. Yeah.
Look, I think that's really good, Marco, and if you can put all of that into action, I'm sure we'll see that reflected in your next term result. So, good work. Thank you.
Thank you.
Okay.